Bart Benson and his son Brock to recognize National Autism Awareness Month.
Bella.
Bart, how are you doing?
Bella.
I'm doing very good.
How are you doing, Brock?
Rock, how are you today?
How about you?
How are you? Did you have a good day?
Yeah.
He's doing good.
Brock, I'm glad you're doing well. You playing with your iPad? Yeah. What age was Rock when you found out that he had autism?
Well, we found out when Rocky was less than 2 years old. And he was probably more like 20 months when his family care doctor did not like that Rock wasn't talking yet. And so she told us if he wasn't saying 3 words at his 2nd birthday, that she wanted further diagnosis going. Okay. And so really before he was 2 years old, we had him in speech therapy and he had a diagnosis at that point.
How important is it that early detection?
It is vital. The studies show that as soon as you can get a diagnosis and know that your child may have autism, the sooner you can get started with the different therapies that are out there and the different treatments that can help. Most important things that we've been involved in are, we believe, speech therapy, occupational therapy, and ABA therapy are huge things that he has been involved in since he was less than 2 years old. He did speech and OT, speech therapy, occupational therapy at Fairhope at Thomas Hospital in their pediatrics rehab. God has really surrounded us by people that have supported us and helped us, along the way.
How was it when, you found out that Rock had autism and you knew, that you were going to need the great support in a support group? And what made y'all choose, the therapy you chose, the school? How did y'all choose that process?
Well, what we did was we began getting involved in the community and the resources that are available here in Mobile, and you just learn about what's available. At first, you're very just heartbroken that your child has received this type of diagnosis, but once you understand truly what it means, that he can still have a very productive life, a very good life, and very happy life, then you begin to accept the challenge and you move on and you find out what's out there and what's best for him. And it doesn't take long to find out about the different things that are available, such as Thomas Hospital, pediatrics rehab, or the Learning Tree school systems. I don't think we have it any harder than anybody else that raises any child. I just think it's different.
Right.
And at first, what is different about raising him can be very stressful and confusing and frustrating. But once I begin to understand that different is okay, and once I begin to be able to accept that this is something that we can all handle and this is no harder than what other parents of typical children go through, then I can be able to accept Rock the way he is. He is a blessing to us. He is nothing less than any other child of another parent, and he lives a good life.
It was very obvious, how much he adores you, and just interacting with him, he is so happy. And I noticed for the viewers, he was playing on his iPad. Can you tell us a little bit more about what he was doing on the iPad?
Sure. The iPad has it was in no way intended for autistic children, but it has become a very vital part of his work that he does. In therapy and in ABA, they use the iPad because it's going to be something that gets an autistic child's attention more than even people do sometimes, because sometimes people to an autistic child can be more than, it can be more stimulation than they can handle. The thing about Rock and the thing about most autistic kids is they can learn the same thing as a typical child, but they're going to have to put in a lot more work, a lot more effort than somebody normally would. And the iPad is something that can really be fun and entertaining for them while they're learning.
Everyone loves to
their
play with an
lessons.
iPad.
Yes.
So, and I know that you and your wife, Carrie, have a younger son, Colt. Do you think that Rock's condition poses any type of strain on Colt?
We do worry sometimes about that Colton does not get the attention that I would like to give him, because sometimes Rock needs more attention. At the same time, Colt also goes to the Little Tree because they interact peer models with the autistic children. And so Colt is learning every day how to deal or how to communicate with his big brother and to build a relationship. And you can really see the things that he learns at school, and he goes to, he brings them home with him, and you can hear him talking with Rock, and it's telling him to use his words instead of getting frustrated. That's what's important, that early on these kids are learning to communicate with the people around them. Sometimes people explain it like autistic children want to live in their own world, and you have to sometimes go into their world and lead them out for them to communicate and to live in the world that everybody lives in.
In closing, what advice would you give to a parent or grandparent who just found out that their child or grandchild has autism, and also, double whammy on you, if they are concerned with, that their child might have, what is the step that they need to take?
Well, a lot of parents are really they're just going to know, even if this is their first child. But if you feel something is not developing appropriately with your child, especially around the ages of 2, and they're not using as many words as other children in their area, in their groups are, then they need to get to their family practice physician and have them evaluate the child. And once the evaluation, if their child has been evaluated with autism, they need to understand that, again, it's going to be different, and because of that, it's going to be very hard. Until you get around the right support groups and be able to be involved in the right therapies and the right school system. And then their child can blossom from there. So the most important thing is to educate yourself as much as you possibly can about autism.
Great. And we appreciate you for tuning in with us. If you want any more information, you can go to our website, www.infirmaryhelp.org, or Bart mentioned Thomas Hospital Pediatric Therapy is where Rock went, and they have a Facebook page where you can find them, Thomas Hospital Pediatric Therapy, and also Infirmary Help is on there. Thank you.